Hi, I am Dr. Sukumar Sura, consultant neurosurgeon and spine surgeon, specialist in endoscopic spine surgery at Asian Spine Hospital. Today we'll talk about structure of spine. So as everyone knows, can see here the structure of spine. Spine has 33 vertebrae. You can see these are called vertebrae. And in between each vertebrae you have a disc. So this is a cushion which helps us in a shock absorber, like a material which is there in between two vertebra. So out of this 33 vertebra, it is divided into the cervical spine where we have 7 vertebra, dorsal spine where we have 12 vertebra, lumbar spine which has 5 vertebra, and a sacrum and the coccyx. So most of the time we get problems in the spine, either in the cervical spine or the lumbar spine, or at the junction, that is lumbosacral spine, which are more mobile. Commonly when we say pain coming from the spine, it can come from the bone, it can come from the disc, it can come from the nerve, or it can come from the joints which are there in the back of the spine. We call them as facet joints, or sometimes from sacroiliac joints. So pain can come from any structure, but commonly in day-to-day life we get, most of the time, pain also comes from the muscles which are there covering the spine. When we say commonly disc prolapse, what happens is the disc, either in the lumbar spine or in the cervical spine, it comes out, it ruptures, and the material comes out from the disc and it presses the nerves. So when it touches the nerves, the disc material, patient will have intense back pain, and when it touches the nerve, that pain radiates to the legs. So when pain arising from the back, that is the spine, and coming down to the legs because of the nerve irritation, we call it as sciatica. Common term we use as sciatica. And there are terms commonly used by people called disc prolapse, slip disc, prolapse disc, so disc problem. So all these are same, because the disc, when it ruptures and the material leaks out, we call it as prolapse disc. And the symptoms coming from that are called sciatica in common terms. Commonly we see these disc problems either in cervical spine or lumbar spine, because cervical spine has more mobility, lumbar spine has more mobility. So the load bearing on these discs are more, and that's why we get more problem in the cervical or the lumbar. And again, commonly people might have heard about cervical spondylosis or lumbar spondylosis. What does this mean? Cervical spondylosis means any cervical spine when it degenerates, that is either because of overuse or because of age, when the joint, that is the facet joint or the disc, degenerates, we call these as cervical spondylosis, and symptoms correlate to the levels involved. Again, this degeneration is very common in either cervical spine or the lumbar spine. Any problem either because of degeneration or because of the disc prolapse, patient will have neck pain, back pain. If neck pain, it radiates to the shoulder, arm, forearm and hands, and if in the lower back, it radiates to the thigh, buttocks, thigh and legs most commonly.